Good afternoon, and thank you all for tuning in for today's important discussion. I'm Congresswoman Lori Trahan, and I'm thrilled to be joined by two experts who have played pivotal roles in getting our community, our Commonwealth, and our country through this pandemic over the past 2 years. I know we have a lot to discuss, but before I turn it over to them, I want to take a second to recognize that we're in a much different place now since the start of this pandemic. Critical frontline workers like nurses and doctors, EMS and police officers, public health workers, they're no longer having to ration critical PPE like masks and gowns. Schools are open and they're staying open with updated protocols designed to keep our kids and our educators as safe as possible. And most importantly, we've developed tools to help us combat COVID-19 and save lives. Vaccines and boosters have helped to keep our communities safe and protected against the virus. And that's not to say there haven't been challenges over the past 6 months, especially with the emergence of Omicron. There certainly have. But since the passage of the American Rescue Plan, our ability to respond quickly to problems caused by the virus has improved, and our road to recovery has shortened dramatically. Not only did it get much needed relief to families and small businesses struggling to make ends meet, but it also played a pivotal role in getting shots into arms. To date, over 200 million Americans are fully vaccinated, including 80% of adults and children over the age of 5. Here in Massachusetts, more than 6 million people have received at least one dose of the vaccine, and over 5 million are fully vaccinated. The vaccine has been key to saving lives and reducing hospitalizations. But new evidence has found that the booster is more important than ever, especially with the emergence of Omicron, which now makes up, still 99% of cases nationwide. Data released in the past week found that vaccine effectiveness against hospitalization rose to 90% for Omicron positive patients who received their booster shot. So to date, 2.6 million Massachusetts residents have gotten their booster. So while we've come a long way, we still have work to do to ensure that every person here in our state has the maximum protection possible from the virus. So that means making sure you're fully vaccinated, including getting your booster as soon as you're eligible. And it means arming yourself with the facts about how to continue keeping yourself and your loved ones safe. And that's why this conversation is so important. And it's why I'm grateful to be joined by two healthcare leaders who will provide important updates on where we're at right now and what the future looks like. They know better than anyone what challenges remain and how we can tackle them together. So without further ado, our first guest isn't new to our virtual discussions, having joined us for multiple conversations last year. Dr. Ashish Jha is a physician, he's a health policy researcher, and the third dean of the Brown University School of Public Health. He is recognized globally as an expert on pandemic preparedness and response, as well as on health policy research and practice. So we're thrilled to have you back, Dr. Jha. Welcome.
Thank you, Congresswoman. It's great to be back.
We're also fortunate to have our second guest who has also joined us for these important discussions in the past. Jody White is the president and CEO of Lowell General Hospital and Circle Health and the chair of the Massachusetts Health and Hospital Association. He has joined us previously to provide critical insight into what's happening inside our hospitals and the impact of COVID on our MA3 communities. So welcome, Jody.
Congresswoman, thanks a bunch. Glad to be here.
Okay, well, I know this much. The folks tuning in right now certainly didn't tune in to hear me speak. So let's get right to the questions. So much has changed since the coronavirus pandemic began 2 years ago. Dr. Jha, it would be helpful to just get a high-level overview of where we're at as a nation right now, especially with the emergence of more contagious variants like Omicron.
Yeah, absolutely. And happy to start there, Congresswoman. So there's some good news on this front. Obviously, it's been a really incredible surge of infections that we've seen across the country. But the good news is nationally, I think we have turned the corner. In the last 5-7 days, we've seen very good evidence that infection numbers are coming down. They're down about 20% nationally. Here in the Commonwealth, infections are down about 50% from their highs. Still at a very high level, but boy, I'd much rather be down 50% than where we were about a week or 10 days ago. So infection numbers are starting to come down. We know from the whole pandemic that hospitalizations and deaths always lag. So hospitalizations are starting to turn It's going to be a little bit longer before hospitals really feel any sense of relief. We'll hear a lot more from Jody on that. Deaths are still pretty high. They too will come down. But the good news, I think, overall in Massachusetts is that we've done pretty well through this surge because we have such a highly vaccinated population. And I just want to take 30 seconds to emphasize a point you made, which is boosters are absolutely essential for every adult. If you are 5 months out or more and you've not gotten a booster, I'd go get one today, like this afternoon, as soon as this call is over. But the point is people need boosters. It makes an enormous difference. Last point, as this surge ebbs, we want to make sure that we start thinking smartly about the future. There is no reason to believe we won't have future surges. There's no reason to believe that this is the last variant. But the good news is we know how to manage this now. And I'm sure we'll have a chance to talk more about that. But we really want to start planning for the future.
Yeah, and look, I don't think we can ever say enough. Go get your vaccination, go get vaccinated, and go get your booster. And so I thank you for emphasizing that. But just following up on that, besides those key recommendations, what do you suggest for families? What do you suggest that they do to keep themselves and their loved ones safe during this surge, and certainly if there are others beyond?
Yeah. So this virus is going to be with us for a long time. And I think we just have to decide, we just have to figure out how to manage our lives without it. We can't be locked down. We can't be shut down. We also can't be fearful of this virus. We now know how to manage it. So, and again, I'm going to start here. Please get vaccinated and boosted, including kids. I think it's essential that kids get vaccinated. I have 2 teenage daughters and a 10-year-old boy. They're all vaccinated. I think that's really, really important. That's the number one thing you can do, because that means if you get infected, it's going to be much, much milder if you do. During surges, I think wearing masks indoors makes a lot of sense. So during surges, not forever, not all the time, but during surges, we're still in one. I'm recommending it. I can imagine in a few weeks when the infection numbers get dramatically lower that it would be reasonable to pull back on that. Last thing is, think about the people in your life that you're seeing who are high risk. People who are very elderly, people who are immunocompromised. Before you spend time with them, use these rapid tests that are becoming widely available. Give yourself a test, give everybody else a test. Just reduces the likelihood that you'll introduce infection into a loved one for whom the infection may end up being a problem, even if they're vaccinated and boosted. Elderly people, immunocompromised people, still vulnerable. So if we do those things, boy, I think we can, do all the things that we love, see loved ones, schools open, go to Celtics games. All of the stuff that really matters is very doable and reasonably safe. We just got to be a little bit cautious around these kinds of issues.
That's great. And we'll talk a little bit more about the tests and the masks and how you get free ones a little bit later. Jody, a lot of people have described Omicron as a fairly mild when compared to previous variants like Delta. We know that for folks who are vaccinated, that may be somewhat true, but that Omicron still poses a threat, a serious threat to the health of unvaccinated folks and people with comorbidities. And no one knows that better than you. We think about you and the frontline healthcare workers who have, tirelessly showing up to work each day in the middle of this surge. And they've been doing it, I'm sure, still exhausted from, what they've been through these last 2 years. Would you mind sharing what you're seeing at Lowell General Hospital and in the greater community population?
I don't know if we hear. It seems like Jody may not be able to hear you, Congresswoman.
Oh, okay. Well, I will come back to Jody once we get those issues sort of resolved. I will, Dr. Jha, if you don't mind stepping in, I'm going to keep going because we've talked about this. I'm the co-founder of the Pandemic Preparedness Caucus, and I'm really interested to know what your thoughts are on our next steps here. I mean, what are some policy decisions that we can make as we continue, to combat this virus? And then what's the most important thing that we should be doing to ensure that we're prepared for future surges or similar public health crises?
Yeah, no, this is a great question. And I would say 2 things. First of all, Congressman, thank you for your leadership on this Pandemic Preparedness Caucus. We really got to take this seriously. We have seen what happens when we don't. And unfortunately, I think the last administration did not do enough to prepare. And then we were really caught flat-footed. And 2 years later, we're still struggling with some of the challenges. So let's talk about that in two parts. What should we do for the rest of this COVID-19, and then how do we prepare for future pandemics? Look, I think the good news, as I said, the surge is ebbing. Let's use this moment to prepare for the next surge.
Right.
Don't know when the next surge is coming. Don't know if it's in the summer. Don't know if it's in the fall. None of us. We've got to get out of the prediction business. Predicting when the next variant is going to show up is very, very hard. Let's get into the preparation business. Let's make sure we have just an absolutely massive amount of testing widely available so that the next time there's a surge that begins to happen, we flood the zone and everybody gets lots of tests. Let's make sure that we build up our stockpiles of therapeutics. We now have treatments that are going to make an enormous difference in making this virus even less deadly. Let's work on doing the best we can in outreach to communities that have not yet gotten fully vaccinated and boosted. I think that's really, really critical. I love where the president has gone on more free testing and free masking, free masks becoming available. I think we've got to continue those things. We do all that. We get ready. The next surge, let it come. We'll deal with it. We'll manage it. We'll keep our schools open. We'll keep our lives going. We will not fill up our hospitals. I actually feel very confident. Over the long run, we have got to build up much, much better surveillance systems. I mean, if you think about this virus, probably circulated in China for months before we heard about it. We were too slow to build up our testing infrastructure. Now I'm going back to 2019, 2020. Let's build up our surveillance system. Wastewater surveillance. Actually, Massachusetts has been an incredible leader in this. We should have this everywhere in the country, right? We should be able to do wastewater surveillance for new pathogens. It's anonymous, surveilling individual people. You're sampling wastewater. Tools like that are really important. And then we have to invest in the science. I mean, what's bailed us out in this pandemic is the science. It's phenomenal vaccines, the therapeutics. We've got to invest in making sure that we're ready with even faster vaccines, even faster therapeutics for the next one. And that really does require investing in NIH and investing in other kind of scientific enterprises. So a lot to do to prepare. But the good news is we know how to prepare for the pandemics. And if we do these things, I think we're going to be able to handle them much more effectively.
Yeah, no, I so appreciate that. For one, I never thought I'd be tracking the wastewater results the way we have, right? I mean, I've been glued because it's been such an accurate predictor. And I do think making sure all cities have, access to that kind of innovation is going to be helpful. So many of the lessons that we're bringing out, as we're going through this moment are already being implemented. I mean, of course, the reason why the president is able to make free masks, high quality masks like N95s and KN95s is because our stockpile is where it needs to be. And there's plenty of backfill so that we can give those free masks out. And so, but you know what? It's never, you can't wring out enough lessons, right? I mean, the surveillance is important. The lab structure is important. Of course, rapid tests, and making sure people have the confidence of knowing that they're not going to transmit the virus when they're, with their loved ones before the holidays, whatever the context. All of that is going to be sort of how we approach our steady state, not just, in surges. So I don't see Jody back with us. So I'm going to ask you another question, Dr. Jha, before we sort of, wrap up. There's been a lot of debate and conversation around how we're going to live with COVID over the long term. And we know we have a vaccine that keeps people alive and largely out of the hospital with serious illness. And we know we have tools like testing and masks to keep kids in school and keep our small businesses open. But my last question is, can you expound a bit on what folks can expect in their daily lives as we confront a new normal, both nationally and perhaps here in Massachusetts?
Yeah. Well, absolutely. And maybe just one more kind of point of the reason why these tools are so important is because the virus is not going to go away. we're going to want to deploy these things on a regular basis and just make them a normal part of how we do things. So let me give an example. One of the programs that I think is a really terrific thing, and again, Massachusetts has been a leader in this. Nice to see the president and the rest of the country talk about it. Is the Test to Stay program for schools. One of the things that we were seeing in the fall across schools and across the country is large numbers of kids out in quarantine because one kid in the class had tested positive, and now everybody's quarantined for 10 days. Totally unnecessary. So disruptive to families. So disruptive to the kids. Totally unnecessary. You need to have lots of tests. You just start testing those kids, let them come back to school as long as they're negative. It's a really powerful tool. So that's how I sort of see the future. And I see Jody back, and I'm excited to hear from him. Welcome back, Jody. Sorry about the technical issues. Very quickly, as I think about the months and maybe even years ahead, what I see is we know a lot about the virus. We know how it spreads. We've got the tools. We live our lives. We pull back on masking as infection numbers get low. We have our stockpiles ready. We're doing our surveillance. We see a new variant or we see a surge starting to build, and we start deploying the tools. And I can imagine in the worst of a surge, let's say things are really bad, the governor or a mayor comes out and says, hey, for the next 4 weeks, really important for people to wear masks indoors. And we deploy it as a tool short term to manage our way through surges. Infection numbers fall again, we go back again. Right. I think we can get to a point where 99% of the things that we all value, find meaningful in our lives, we can do safely. And then that around those margins, we're going to have to make some tweaks because the virus is still going to be around. But I think we can do that without disrupting our lives or our livelihoods or filling up hospitals that Jody needs to have functional, because hospitals exist to take care of a lot of things beyond just COVID. And we need our hospitals to function. But let me turn it over back to you and to Jody.
Yeah, no, I appreciate it. And look, we've talked about this in the past. I mean, we have children similar age. My daughters are 7 and 10. And, you can imagine very quickly why we don't have the labor force that we need right now in this moment, because you get that call, and that call could come, because a child has sniffled and gone to the nurse and needs a positive test in order to go back, or they've been exposed, right? And so the innovation and the way that we've been able to adjust, to that quarantining after an exposure and the test and stay programs has been, it's eased that disruption, and it's really helped families and children stay in school. So great point. I know testing is going to be part of our daily lives for the foreseeable future. Jody, it is great to have you back. And
sorry about that.
I think Dr. Jha said it best. Hospitals exist to care for people with so many things well beyond COVID. And I'll ask you a little bit maybe about, sort of what you're seeing in Lowell General. But where I started the question, and when we is that a lot of people described Omicron as a fairly mild, when compared to, previous variants like Delta. And we know that for folks who are vaccinated, that it's largely true, but it still poses a serious threat to the health of unvaccinated folks and people with comorbidities. And so my question was, would you mind just sharing what you're seeing at Lowell General Hospital and in the greater community population?
Congresswoman, I'd be happy to. And again, I apologize for the technical difficulties there. Glad I'm back. Indeed, we still are in a very, very busy time. As Dr. Jha said, we are seeing numbers dropping. That is a welcome sign of relief for, I was talking to my colleagues on the MHA call this morning, and everybody's seeing the same thing, which is good to see. Numbers coming down. But as you said, Omicron is more contagious, so we're seeing a lot more cases of it. In fact, I think they had to reset the access because the numbers was just so high compared to the previous surges. But when you look at the total number of deaths, that is a description of vaccine inaction, and that we are seeing with a huge increase in virus, we're not seeing as many folks as badly ill. That being said, in my ICUs today, any of the folks that are in the ICUs today with COVID are unvaccinated. I don't have people in the ICUs that are intubated on pressors and getting steroids for their lungs that are vaccinated. It's so the vaccine works. And to Dr. Jha's point before, get vaccinated, get boosted, whatever's available to you, get it, because it truly does work. Hospitals across the Commonwealth are still wildly busy. We've put off an awful lot of elective surgery, and there's an awful lot of comorbidity out there where folks that have delayed care are now getting in, and we are dealing with a very, very sick population of folks. Most hospitals are surged. Lowell General surged in ICU, surged in medical surgical cases, and we're having trouble getting folks out into post-acute care because nursing homes are also having difficulty with spread and some forced freezes on taking patients in. That being said, the vaccine is working. The trace and wastewater measurements are coming down dramatically. Our employees, Lowell General Hospital has about 3,200 employees. We had 300 and 400 out at some point. We're down to 70. So we're doing much, much better there. And so we're doing well. But the point is that we're still in the thick of it. Dr. Jha is correct. The hospital piece lags by at least a couple of weeks, probably a month. So I think we'll see a better day in another 2 weeks or so. But we are turning a corner, and I'm looking forward to a future that will be a little bit more predictable because we do know what we're dealing with now. But all being said, something to look forward to as you try to turn a bit of a corner here in this most recent surge.
Great. And then, so you should have, Dr. Jha actually answered all the questions that I had for him. But I do want to ask you, I think all of us are thinking about the frontline healthcare workers, the people who are in the hospital day in and day out, really managing this surge, right? I mean, and that's while, after 2 really tough years, where I'm sure, no one in the nursing or the physician community or even the staff at these community hospitals have been able to focus on their own wellness and their own mental health. And so wondering if you could just talk a little bit about how can we support you and those healthcare heroes in your critical life-saving work.
Yeah, hats off to the healthcare workers across this country. When I watch the folks every day as I round Lowell General Hospital, it's nothing short of amazing and impressive, and a dedication to putting patients first in everything that we do. I think the things that can be done to help are straightforward and simple. The first is get vaccinated and get boosted, because if you do that, you're not going to end up in the ICU with ICU nurses and docs that are very, very tired. Folks say that it's a personal choice. I do believe it is a personal choice. But when personal choice ends you up back in the ICU, I think you'd have to question appropriateness. So it's important to get vaccinated and get boosted. Second, during these times, let's not use the EDs and the urgent care centers laissez-faire. If you've got a major crisis, come on in, but use your PCP. Use other venues, and don't come to the hospitals for the urgent care or for ED, because we are wildly, wildly busy for the next month or so, and it's terribly important. And then third, just be vigilant. We know that for now, vaccines work. We know that masks help. We know that there are certain things that we can do in our lifestyle and our practice to be sure that we are being vigilant. And if we can do those 3 things together, that'll help us an awful lot, because I'll get my employees back to work. We'll take the COVID burden down. We'll stabilize a crisis that we're in, and we'll be much better for it on the other side.
Great. Well, thank you. We chatted a little bit about so many things, sort of where we've been, where we're headed, what the new normal, could look like, and what folks can expect in their daily lives as we confront that new normal, and all the adjustments that we've been making along the way. I do want to be respectful of your schedules, and I look, you're always so generous with your time, but that's sadly, I think it's all the time we have for you for this afternoon. I want to say thank you once again, our incredible guests, for sharing their expertise with us. And of course, for all of you who are tuning in and just staying informed. I think it's important to remember that we're all in this together as we come together once again as a community and a Commonwealth to combat these variants. We need to make sure we don't leave anyone behind. And that means doing everything that we can to keep ourselves and our loved ones safe and healthy. So if you haven't already, please, please, please get vaccinated. We know that Omicron variant is serious, and we know that the vaccine and the booster are key to keeping infections mild and preventing serious illness and hospitalizations. So if you head to vaxfinder.mass.gov, right now you can easily schedule a free appointment right near your home or work. Tests and masks are also more critical tools in our toolbox as we continue to confront this pandemic. Thanks to the Biden administration, you can order a free at-home COVID test right now to be delivered straight to your door. And to do that, you just visit covidtests.gov. That's COVID tests, plural, .gov, or click on the link that I just dropped in the comments. And finally, the White House is also working to provide all Americans with free, high-quality N95 and KN95 masks. These masks will soon be available for free at your local pharmacies and community health centers, and I'll be sharing updates here on Facebook and Twitter as we get them. So keep an eye out for more information in the coming days. So once again, thank you. Thank you to our incredible guests for joining us today. And thank you all for tuning in this afternoon. I want you all to stay safe and stay healthy. And I look forward to seeing you all again soon. Take care.
Thank you.